Airborne and contact precautions. Donning PPE using N95 respirator. Only use N95 if you have been previously fit tested. Perform hand hygiene. Rub your hands together, covering all surfaces of both hands, including between your fingers and up around your fingertips and nails. Rub hands together for 30 seconds to allow your hands to completely absorb the product and the hand sanitizer to completely dry. Don gown. Ensure gown is secured around neck, thumbs, and tied in the back. Don recommended N95 respirator as instructed during your hospital fit test. Lay mask flat in your hands with nose piece at fingertips. Cup the respirator in your hand, allowing the headbands to hang below your hand. Position top strap at the crown of your head. Position bottom strap around the base of neck and below the ears. Do not crisscross straps. If respirator has a nose piece, it should be fitted to the nose with both hands. Do not pinch the nose piece with one hand. Respirator should extend under your chin, protecting your mouth and nose. Perform seal check. Place hands over face piece and exhale gently, careful not to touch face. If air leaks around the nose or respirator sides during the seal check, adjust nose piece and straps. Perform hand hygiene. Apply clean gloves. Remove respirator and visually inspect for damage. Discard if contaminated, wet, creased, or bent. Don and make fit adjustments just as first-time use. Perform seal check. Discard gloves. Perform hand hygiene. Don surgical mask over N95 respirator to reduce surface contamination during patient care. Don goggles or face shield. Perform hand hygiene. Don gloves. Select gloves, making sure they fit securely. Pull them over the cuffs of your gown to cover the edges of the gown sleeves. Airborne and contact precautions. Doffing PPE using N95 respirator. Remember, the outside surfaces of your mask, gloves, and gown are contaminated. PPE must be removed deliberately and slowly in a sequence that prevents self-contamination. If any risk of contamination during removal, immediately perform hand hygiene with alcohol-based hand rub for 30 seconds. Remove gloves using glove-in-glove technique. Using a gloved hand, grasp the palm area of the other gloved hand and peel off first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove. Discard in waste container near door immediately after removal. Remove gown. Tear perforations on waist and at back of neck. Pull gown away from neck and shoulders, touching only the inside of the gown. Turn inside out as you remove it, rolling into a bundle. Discard in waste container near door immediately after removal. Exit patient room. Combine removal of gown and gloves. With gloved hands, grasp front of gown and break ties around waist and at neck. Pull gown away from neck and shoulders, touching only the outside of the gown. Turn inside out as you remove it, rolling into a bundle. As you remove the gown, peel off gloves at the same time, only touching the inside of the gown and gloves with bare hands. Discard in waste container near door immediately after removal. Exit patient room. Perform hand hygiene. Remove goggles or face shield. Tilt your head forward slightly, grab the earpieces or strap at the temples and pull upwards and away or over the head. Remove without touching the front. Place in designated receptacle. Remove procedure mask covering N95 respirator. Grasp bottom ties or elastic from ears of the mask. Remove without touching the front of the mask. Discard in waste container. Remove N95 respirator. Remove bottom strap by touching only the strap and bring it carefully over the head. Grasp the top strap and bring it carefully over the head. Pull the respirator away from the face without touching the front of the respirator. Perform hand hygiene. Don gloves. Inspect N95 respirator for signs of damage or contamination. Discard if present. Label the N95 respirator in paper storage bag with your health system issued user ID and designated drop-off pickup location. Keep used respirators in a clean, breathable container or paper bag between uses. Remove gloves using glove-in-glove technique. Perform hand hygiene. Don gloves. Disinfect goggles. Wipe down all surfaces with approved disinfectant product for the appropriate contact time. Place in designated clean location. Disinfect face shield. Wipe down all surfaces of face shield with approved disinfectant product for the appropriate contact time. Place in designated clean location. Disinfect contaminated surfaces outside of room. Wipe down room door handle and flat surface used to set down N95 with approved disinfectant product for the appropriate contact time. Remove gloves using glove-in-glove technique. Perform hand hygiene.